Good afternoon. I'm Tracy Sinclair, and we are getting set up here for a press conference. This will be Governor Mike Dunleavy, Senator Dan Sullivan, and Congressman Nick Begich, all downtown, and it looks like they're beginning just now. Let's listen in.
Well, anyway, hey, thanks for assembling for this press conference, because I think this is fantastic news for Alaska. So some of you may have seen that through a lot of hard work by the gentleman to my left and my right and Senator Murkowski, we had a tremendous opportunity put into a big, beautiful bill that was definitely consummated here recently through the Department of Health and Social Services at the federal level. So our team at the Department of Health put together a strong application for this grant that we received. Today, CMS announced that Alaska will receive $272 million in fiscal year 2026. Only the state of Texas received a larger award amount. This is going to enable significant improvements to life and safety in rural Alaska. It's going to totally transform our healthcare system from how it's done today to what it will look like for a 22nd century healthcare system for our people in Alaska. I want to thank each of these folks and Senator Murkowski, as well as the Trump administration, Dr. Oz and others, for working very hard to make this happen for Alaska. As you know, Alaska is a very unique state in terms of its size, its complexity. Rural is Alaska. Alaska is rural. So this sits really well for what we need to do. And again, we're going to talk a little bit here with just some specifics on what we may be looking at in terms of changing our healthcare system. As you know, many of us have a hard time navigating the healthcare system. Many of us have a hard time understanding the healthcare system. It's pretty complex. This is going to help us, I think, be able to do a point of care, as they call it. And some of our folks here in Health and Social Services will talk about that. And then, long story short, the healthcare system we have today compared to what we're going to have here in just a couple of years is going to look radically different. The outcomes will be radically different for the better. And the costs are, we hope, through technology and other approaches, is really going to be able to help us contain costs going forward in our healthcare system. So this is fantastic news. And I'd like to have our Senator, Dan Sullivan, come up, and then Congressman Begich. But they're going to talk about how this happened, how it came about, and why this is a great thing for Alaska. So, Senator.
Okay, Governor. Thank you, sir. And Merry Christmas, Happy New Year to everybody. I'm really honored to be here with the Governor, Commissioner Hedberg, who's done a great job in this area, Congressman Begich, about some just incredibly exciting news. And, you know, it's $272 million per year for 5 years, okay? That's going to be the award. That's almost $1.4 billion over the next 5 years from the federal government to transform our healthcare system in Alaska. This is a generational opportunity for our state. You may have seen Dr. Oz talked about this is the biggest investment in rural healthcare in American history, nationally. That's $50 billion, and it's certainly the biggest investment from the federal government to Alaska's healthcare system in our state's history. So it's really exciting. I want to thank the governor and his team, Dr. Oz, Commissioner Sarah Bell on my team. She's brilliant. She's listening in, I think. If you have really hard questions, ask her and Heidi, who they've worked really well together. But I think with the application that the Dunleavy administration put forth, it's an example of the power of local, tribal, state, and our federal delegation, all the stakeholders working together to get results for Alaska. And it's pretty exciting. So the governor mentioned, I'm going to talk a little bit how we got here, because I think it's important. This is a topic that I've been working on in one form or another for almost a decade in the United States Senate. And the challenge we've had is that we've heard this a lot, that a one-size-fits-all federal policies certainly don't work almost anywhere in Alaska, but they really don't work for health care. Our state has the highest health care delivery costs in the country because of how big we are, fragmented our system is. We are the most rural state in the country. And yet, when it comes to health care funding from the federal government, Alaska has consistently been left behind, receiving fewer dollars per capita than almost any state in the country that have much lower costs and much easier access to care. None of this has made sense. And Alaskans, all of us, have felt the consequences, traveling thousands of miles for treatment, strained rural health clinics, very high costs. With regard to federal funding, for decades, it's been a system that demands that Alaskans pay more for less. So when I came to the Senate in 2015, I really saw this frustrating reality in how poorly federal health funding in formulas throughout the federal government, one-size-fits-all formulas, did not meet Alaska's significant and unique needs. Let me provide a couple examples. The Medicaid's federal medical assistance percentage, that's called the FMAP. That sets how much the federal government contributes to Medicaid. Medicaid is a shared state-federal program. Despite our highest healthcare delivery costs, our highest costs in the country, our extreme geography, Alaska, when I first got to the Senate, received the statutory minimum for FMAP, 50/50. That is the lowest in the country. We now have 52/48, but still one of the lowest. Other states have much higher FMAP provisions. The District of Columbia, 70/30. The feds pay 70% of their Medicaid. Idaho, 71% feds. Utah, a very wealthy rural state, 70% federal government. This is hundreds of billions going to these states where we got the short end of the stick. Mississippi, 77% feds pay for their Medicaid. So these discrepancies continue to exist, and additionally, we're the only state in the country when it comes to Medicaid that we don't use what are called provider taxes and state-directed payments, which is kind of a scam system that states use to pump up their federal Medicaid dollars. We're the only one who doesn't do that. So fixing this inequity in terms of formulas for federal dollars to our state for health care has been a huge priority of mine. And when we did the budget reconciliation bill last year, or this past year, in the debate over that, my team and I had worked for months to get an increase to our FMAP, to get it to 65%, from 50 and then 52 to 65%. And we included Hawaii too, make this bipartisan. They have a lot of our challenges. I went to the president directly and got him to commit to this, made the case to all my Republican Senate colleagues. They put it in the bill. We put it in the bill. Alaska was going to get a 65% FMAP statutory in this budget reconciliation bill. It was actually in the bill. Unfortunately, we were on the 1 yard line getting ready to pass this bill. Deep in the night, actually it was in the morning, the Senate Democrats, led by Minority Leader Chuck Schumer, specifically challenged this provision with the parliamentarian under what's called the Byrd Rule on a budget reconciliation bill to strip it out. We fought it, and unfortunately we could not beat back Schumer's attack on the Alaska FMAP. By the way, just as an aside, I've given this presentation all throughout the state to dozens of people what's in the budget reconciliation bill. It's a great bill for our state. Here's a slide that shows how many provisions Schumer and the Senate Democrats tried to strip out of this bill that were great for Alaska. They targeted everything good for Alaska. The only one, there's a ton of them. The only one that they actually got stripped out of the bill was this FMAP provision. So we were not to be deterred. Although I will tell you, I did a press event, said it was kind of the dark night of the soul for me. I'd been working on this issue for a decade. And at 4 a.m, this provision was stripped out. So we pivoted and said, how can we make up for what we're going to lose? About $200 million a year that FMAP provision would have brought to Alaska. By the way, another irony is you've seen these ads on TV saying the budget reconciliation bill, Congressman Begich, myself, voted to cut Medicaid. We didn't vote to cut Medicaid at all. There's nothing in this bill that cuts Medicaid for Alaska. The only guy in D.C., literally, factually, who cut Medicaid for Alaska was Schumer and the Democrats. That's a fact. But we weren't going to be deterred. So we worked on this bill, continued to work on this bill, particularly the Rural Health Transformation Fund, and amended what was in the bill significantly with the support of the White House, support of the Senate Republicans, because they saw that this FMAP provision is so important for Alaska, got stripped by Senator Schumer, and we were able to add a number of things. We doubled the size of the fund from $25 billion to $50 billion. We put in a formula that would emphasize rural states most favorably when CMS was going to look at these applications. We made sure that there was a base amount that every state got in the bill, $100 million, not a per capita formula, but every state starts with $100 million, which has a huge benefit for us. So we worked this with Senator Murkowski on the Senate side, and the conclusion is what we're seeing today. What has emerged is really what the governor mentioned in this announcement, the largest, as I said, federal investment in rural health care in American history. And certainly with this award, there's only one other state that had a larger award for us, a much bigger state, that's Texas. We think this is a great opportunity. But it's also really important from a policy perspective because it is finally starting to move away from one size fits all from Washington, D.C. on federal health funding for our state. Now, we all know that more dollars from the feds is not alone automatically going to produce better health outcomes, but targeted, thoughtful investments paired with accountability, which is what this bill does, can and will make an enormous difference. This funding will help keep care closer to home, reduce the need for costly and disruptive travel. It will strengthen rural clinics, stabilize healthcare workforces, and it gives our state, as the governor said, a real opportunity, generational opportunity, that can build a system that works for our communities, and very importantly, it gives the governor and his team and states and the state legislature the freedom and power legislatively to design a healthcare system that works for our state and its unique needs. This is literally the opposite of one size fits all. So let me conclude by saying that's how we got there. The commissioner is going to talk about what we need to do next. We have challenges, huge challenges in the healthcare space. Obamacare did not make healthcare more affordable for Alaskan families. The law crashed Alaska's healthcare insurance market, and the premiums that Alaskans have paid since 2013 have skyrocketed. Insurance companies got wealthy, and Alaskans paid the price. I'm continuing right now as we speak. I was on a call just 2 days ago with some Democrat and Republican senators on continuing to extend and reform ACA premium subsidies. That's a big issue. But today is a different issue. That's an issue on health insurance access, which is a huge challenge. This is an issue on health care access for Alaskans in our state. And it's finally the first time that I've seen it where the federal government is providing the funding that we can design a program with that actually meets and reflects our unique challenges. And that's why I'm really honored to be here with the governor, Congressman Begich. Historic day for our state in terms of investments in healthcare from the federal government. And we all work together over the next coming year and years after that. We're going to transform our state's healthcare system in a way that's going to be really exciting, is going to benefit everybody. Thank you. With that, I'm going to turn it over to Congressman Begich.
Thank you. Thank you, Senator. And thank you for those of you who are joining us today, either virtually or in person, for this historic announcement. In Alaska, our approach to healthcare delivery has always required a different way of thinking. When communities are separated by hundreds of miles with no road system, extreme weather is a constant factor, and many of us have experienced this even recently. Limited infrastructure presents its challenges. Doing things the usual way here in Alaska simply is not an option. That's why the Federal Rural Health Transformation Program is such a crucial investment for the people of Alaska. This program recognizes a simple truth: rural states need smart, flexible investments in health care. It delivers care closer to home and provides greater flexibility to the patient. The Rural Health Transformation Program was made possible through the One Big Beautiful Bill, or what Senator Sullivan has rightly called the Alaska Opportunity Act. The Budget Reconciliation Bill that was passed in July of this year delivered historic wins for Alaska, unlocking countless opportunities for our state. And while many of those successes get attention, this critical investment for rural health care should not be overlooked. For rural Alaska, this funding is an historic investment that will have lasting impacts on families in Alaska. This program has the potential to strengthen our healthcare workforce, expand access in remote communities, and focus more resources on prevention and chronic disease management, areas where Alaska has an opportunity to significantly improve. Rural healthcare in Alaska requires innovation and support at the local level. I want to recognize the Alaska Department of Health for the coordination and leadership that made today's announcement possible, and I'm proud to support efforts that strengthen rural health care and help ensure that geography has a diminishing role in determining the quality of care that Alaskans receive. Now I'll turn it over to Commissioner Hedberg to talk more about how Alaska will put this investment to work.
Thank you so much. What we know is that our current healthcare system in Alaska is fragmented. We, for the average Alaskan, it is difficult to navigate. It's frustrating for providers. And we see it in Medicaid and we see it in other health insurance that the costs continue to go up. We are really excited to receive our notice of funding award today with that $272 million funding, because this is going to be transformative. This is going to transform how Alaskans access health care. These funds are going to be leveraged, they're going to be used so that Alaskans have care closer to home. When we think about our demographics in Alaska and where we want to be in 10 years, in 20 years from now, we know that we have an aging population. We want to build out loans so that seniors can receive care closer to home. We want to build a healthcare system that instead of paying for sick, we're in on paying for prevention. 75% of Alaskan adults have one or more chronic diseases. Chronic diseases are driving up our costs in healthcare. This funding, the Rural Health Transformation Program funding, is really going to get at the core of addressing chronic diseases and driving those chronic diseases down. We want to use this funding so that providers, those doctors, are spending more time with their patients and less time focusing on the paperwork. Well, what does that mean? That means that we're going to be using this fund for technology, for data integrations, so that when a patient is moving from one provider to the next, their health information is transferring with them. We were very excited when the announcement came with the Rural Health Transformation Program, and so we started in July meeting with various associations in the healthcare sector, meeting with providers, listening to Alaskans who really helped shape our application. If you go to the Department of Health website, in the search engine, you just Google rural health transformation, you will see the application that we submitted to the Centers for Medicaid and Medicare Services. And you'll also see the 6 initiatives that is really the core and the focus of this application. Healthy beginnings, increase access to healthcare, healthy communities, strengthening our workforce, sparking technology and innovation. We are really excited to be working very closely with CMS in the next coming days. We'll be rolling out more information on how Alaskans can tap into this new resource so that we can work together to transform our healthcare system.
We ready, Grant? Jeff, okay, questions, Jeff?
Okay, we'll start with questions here in the room. One is from Hannah Floor with Alaska Public Media.
Can you tell us who it's directed to?
I'm not sure who it's directed to. Maybe you'd like to take it. I'm curious how this money's going to be dispersed and what restrictions there will be on how it's spent.
Yeah, come on.
Thank you.
So Alaska, just like all states, received their notice of funding award from CMS, and so we just found out today that we're receiving $272 million, and we need to update our budget. And once we update our budget, CMS release those funds to the state. In the middle of January, we're going to be holding a convening for healthcare providers and community-based organizations, and we'll be sharing more details on how Alaskans can access this funding.
But it will be dispersed through, it'll be dispersed through healthcare professionals, or, each hospital will be applying for, within those 6 initiatives, creating programs. Like, is there any sort of parameter understood for dispersal at this moment, or is it kind of up in the air, still to be designed?
I would say that community-based organizations, federally qualified health centers, hospitals across the state. Again, this funding is going to benefit all Alaskans. They will be able to learn more information on how to apply for this funding in January.
Thank you.
Okay, now we'll go to Jeff Landfield with the Alaska Landmark.
Hi, I just had a question on the more macro level, maybe for Senator Sullivan or Congressman Begich. We're like almost 20% of our healthcare spend. 20% of our spending is in healthcare is for GDP is 20%, and our per capita spending is 15,000. It's higher in Alaska, and I'm on the exchange. My deductibles now next year almost $800 a month. My premium is $800 a month. Deductible is $10,000. So I guess in this country where we spend so much on healthcare, such a high percentage of GDP, the highest in the world per capita, why do so many people continue to just have to pay so much money for insurance?
Look, Jeff, I'll take a crack at that. It's a really important question. Yeah, the statistics that you cite are, I think, pretty accurate. I would say that there's a realization, as I kind of mentioned in my opening remarks, that the Obamacare, the so-called Affordable Care Act, did not make health care more affordable. And there's a relook, even among Democrat senators. You had a prominent Democrat senator from Vermont go on the Senate floor, said just what I said, that Obamacare did not make health care more affordable. So there's a lot of bipartisan work going on, in particular about reforms, broader reforms to the system that don't send, and it's a ton of money, all those premiums, the premium tax credits, the subsidies under Obamacare, they don't go to you, they don't go to people in the individual market, they all go to the insurance companies. So the people who have benefited, in my view, from the current system that we've had for the last 10 years, if you look at stock prices, if you look at executive compensation, all the insurance companies, they've done really, really well under this system. The average American, the average Alaskan, I don't think has. The good news is on this, I think there's a recognition of that in the Senate, this premium tax credit debate, which, by the way, I don't want to sound too partisan here, but that was a party line Democrat vote on creating those during COVID, on creating the the cliff that we're seeing right now that'll hit Alaskans in the next couple days on the premium tax credit side. The deadline at the end of this year was their decision. But you're raising a really good point. You know, hardworking Alaskans are going to be impacted by that. Many impacted negatively as it relates to premium costs. So I'm hopeful, and I've been working with a group, pretty big group of bipartisan senators, for a way to, in the next 2 years, extend and reform these premium tax credits. There's a lot of evidence that there's been very significant fraud in that market. Nobody wants fraud. And then transition away from those into a system that focuses on the federal dollars going to the patient, going to the individual. This is through the potential of HSA accounts and other reforms that are getting a lot of bipartisan interest in the Senate. I'm, you know, as I mentioned, part of this big group. But I think there's an awakening that, and we've had this for a long time, that the system is not working. For Alaska, certainly, but across the country, for the reasons you mentioned. The amount of subsidies going to prop up the marketplace under Obamacare is in the hundreds of billions every year, and it's not making healthcare more affordable. That issue, as I mentioned, is kind of an issue of access to insurance. This issue, the announcement today, which I think is an unmitigated good for our state, for everybody, is about access to healthcare, particularly in a big rural state. If you can access healthcare more close to home, meaning in our state, and we have a trained workforce that comes up here and stays here, that's going to bring healthcare costs down. That's going to bring delivery of healthcare down. And that's what this fund is all about. And we now have, like I said, about $1.4 billion to work together to try to revolutionize the system here. Commissioner Hettenberg and her team and the governor put together a strong application on how to do it. But as she mentioned, we're going to want input from everybody. This is going to take all stakeholders. But for the first time, maybe ever, Alaska is getting federal dollars that match the unique challenges that we have. So you're raising an important issue, particularly on the insurance side. Today is about access to health care for Alaskans. And as I've been saying in this budget reconciliation bill, no state has done better than us in that bill. And no state did better today than we did on the announcements from CMS, if you look at the other grants and awards that went to other states in the country.
Thank you, and I have a couple questions. The first is just a quick follow-up for Representative Begich. Both of Alaska's U.S. senators have voiced support for a temporary extension of the enhanced premium tax credits. Do you support that?
With reforms.
With reforms?
I do with reforms. And I think what we saw in the Senate was that it was a strong attempt to extend those. It did not pass the Senate. In the House, we're looking at some possible ways to extend the enhanced premium tax credit subsidy, but to pair that with durable reforms that will address the fundamental cost of care. And that's something that I support.
All right. And then this will be for the commissioner. I have a question about the application that you put together. The application, or some of the criteria for judging the application, includes certain expectations that maybe come from the Trump administration for certain policy reforms. They include ensuring that students in public schools participate in the presidential fitness test, that the SNAP program not allow purchases of soda and drinks and other unhealthy foods, and then that states join licensure compacts, a few other things. And the application essentially says that the state will take action on all of these kind of policy goals, including saying that Alaska will join licensure compacts, for example. That's something that's up to the legislature. I'm curious kind of how you committed to taking some of these steps, given that in some cases it's up to the medical board, in some cases it's up to the legislature. It's really not up to the Department of Health necessarily to make these promises.
Yeah, thanks, Iris, for that question. I would say first we had a lot of conversations to see, take a pulse check of where there was interest. We also took a step back and said, what does our existing healthcare system look like today? And where do we need to go and where do we need to shift? And what's working and what's not working? And so there are various policy decisions that were made and commitments made within the application, and we're going to be following through with these policy commitments in partnership, working with the legislature, working with the state medical board, working with the various associations over a period of time. They don't all have to be implemented this year. It's implemented over the course of the 5 years.
Do you expect the state could receive less funding if, for example, there's pushback from the legislature for some of these things that require legislative action?
So that's a good question, and I'm not trying to, Heidi's doing a great job, but that discussion has to occur with the legislature. This is a huge chunk of money that'll do, I think, a lot of good. But as you mentioned, there's things in there as some would say prerequisites to be able to receive the money. We'll have those discussions with the legislature. We'll weigh the pros and cons of both, and hopefully we can take advantage of this. And again, there will be a discussion with the legislature. We have to discuss with the legislature everything that's in that application so they understand as we go forward. But you know, that's something it's going to be a very interesting session in more ways than one, okay? And having this announcement today gives people time to think about this. They're going to be able to take a look at the application, see what's in there, and then we can, once again, Iris, discuss where we're going to go with some of these things.
Okay, we'll take questions now from the teleconference line. Our first one is from Jack Barnwell of the Fairbanks Daily News Miner. Jack, your question, please.
Yes, this is for either Rep. Begich or Senator Sullivan. Looking 5 years down the road, do you see this potentially being renewed, especially if it's successful in its goals?
This is Congressman Begich. I'll take this to start. I do think there's a tendency in government to continue funding programs once they've been put into place. So if we've seen success here, I'll tell you, I'll speak for myself. I'll be an advocate if I'm still in this role at that time to continue investments of this nature. I mean, at the end of the day, we're trying to, as both Governor Dunleavy and Commissioner Hedberg and Senator Sullivan have already pointed out, we're trying to transform health care, right? There's a whole discussion in the nation right now about health insurance, but what's happened to the health insurance market is that the health insurance premiums for many people have become so expensive that they're afraid to actually use the care provided under their insurance companies because of copays, very large copays. What we need is to fundamentally reform, my view, health care, the cost of that care, the quality of that care, so that we actually improve the health of people's lives over a longer period of time. And investments like these help us to make that transformation.
Yeah, and Jack, a couple things. I agree with Congressman Begich. I think it's going to be determinative 5 years from now on how successful the program is. $50 billion, as I mentioned, is the largest investment from the federal government's perspective ever in rural health issues. If that's viewed as being very successful, then I think you'd have a really good chance of some kind of renewal. If it's not, and I think it's going to be all in the execution from all the different states, then you might have a very different equation as it relates to renewal. That's pretty far off in the future. Reporting from Fairbanks, I'll just mention one of the lessons we took as we put together this fund, and as I mentioned, the statutory elements that related to how CMS was going to judge these applications was actually from the COVID Relief Fund, where the Fairbanks Memorial Hospital was stuck in this strange netherworld of barely being able to get money because of the way in which they defined different hospitals getting receipts from COVID money. There were rural hospitals in the lower 48 that were getting $40, $50 million to get through COVID to keep them alive. Fairbanks Memorial was scratching by for like $2 or $3 million. We worked that issue nonstop with the leadership in Fairbanks and HHS the federal agency during COVID to say, you cannot leave Fairbanks like with no funding when the rest of the frickin' country has funding. It was all in the definitions. So what we did in this bill is every institution, every hospital, including in Anchorage and Fairbanks, has a rural definition. So we're not going to go through that challenge again. And then, Jeff, one more thing I wanted to come back to you on, where there's been a lot of progress, has not made a lot of news, but the president and his team just last week or 2 weeks ago, in addition to what they did in May, have made huge progress on one of the highest elements of healthcare in America, and that's the cost of prescription drugs. They are doing what's called a MFN, Most Favored Nation approach with all the big pharmaceutical companies. You may have seen this announcement just 10 days ago by the president and HHS secretary with, I think, 9 of the top pharmaceutical companies, that they're going to start bringing the prices Americans pay for prescription drugs to the same level that Europeans and Canadians are paying. That is going to have a really big impact, and I really applaud the Trump administration on that. It's something we've been encouraging them to do. They've done it in a huge way, but I think you're going to see one element of the high cost of healthcare in America, which is very high prescription drug prices, relative to other industrial democracies. You're going to start seeing that drop a lot, and I think that's going to have a very positive impact on healthcare costs.
Just I wanted to add something. That actually was a great question, because when the staff brought this opportunity to myself and the executive, the question I had was, is this going to be a subsidy? Is this going to be something that we have to go back to the federal government every year to subsidize? And the reason that I blessed this application was it wasn't going to be. It was going to be transforming the system we have now to a much better system that's understandable, low cost, and effective. We don't have that now, for the most part. I think most of us agree. It's very difficult to understand how we get diagnosed, how we're sent to our specialist, how does insurance play into that, et cetera. So the idea behind this was to break that cycle and develop a new system that in the end will be lower cost, we hope, using technology, better at diagnosing, and then better at addressing what the issues are. You know, I don't want to talk about when I was a kid, but when we were a kid, the hospitals were for cases of trauma. You got hit by a car, you broke a leg, that sort of thing. Now, there's a lot of high utilizers in the system for a whole host of reasons. The idea behind this, as it was explained to me, and I think it's a great idea, is federal government will cede our ability to develop a brand new system that really kind of works out the issues of how do we diagnose, how do we prescribe, how do we deal with the various medical issues that people have, and how do we do it from a distance or where you're located. So if it was just a subsidy and it was just going to be ongoing year after year after year, that'd be a whole different ballgame. We'd probably have a different discussion here today. But this is a real opportunity to build something brand new that we all believe will be effective. And with the stakeholder input, I'm pretty optimistic that we'll get there. It's going to happen over a few years. It'll happen, it'll really take off in the next governor's term. But we're going to make sure that what we develop, we put the framework in that's going to lead to success and give us the outcomes that we want.
Okay. Our next question is from Rasha McChesney with the Chilkat Valley News. Rasha, your question, please.
Thanks, Jeff. Can you hear me?
We can, go ahead.
Okay, great. First, I got 2 questions, and the one is for community runoff, which are solely dependent on tribal providers. Could you talk about how you plan to work with tribal organizations? The funding will come directly to them, or all flow through the state first?
Thanks for the question. This is Commissioner Hedberg. So every state submitted a single application. So the Department of Health, the funding will flow through the Department of Health. Tribal health organizations, unaffiliated tribes, hospitals, clinics, community-based providers will all be able to apply equally to the system that we are setting up.
Okay, and just a quick follow-up on that. Will the tribal health organizations be able to control the prioritization of some of the states? I guess
the state's healthcare priorities in their areas, or will they be able to opt out of certain programs? And if so, where does that leave communities like the Chilkat Valley, which are served exclusively by them?
So the application development was in partnership with our tribal health organizations and our unaffiliated tribes. So their voice was definitely included in the application. When you look at the 6 initiatives, really what you need to imagine is that this is a menu of opportunities to transform healthcare to increase the health of your community. And so they will be able to apply individually just like every other community.
Okay, and now let's go
Thank
to
you.
Claire Strempel with the Alaska Beacon. Claire?
Hi, thank you. As you're thinking about transforming the Alaska healthcare system, and especially considering strained rural health clinics, is there a plan for sustaining services that already exist?
Hi, that's a great question, and that's probably kind of one of the most important and core questions that we were evaluating in developing the application. I know too that's been an underlying challenge nationally that the Rural Health Transformation Program was based on. How do we make sure that we're sustaining core services in rural areas? And as we wrote the application and as we outlined the initiatives, part of our focus was making sure that rural communities and tribal communities could see some of the ways that they want to sustain their programs and evolve or build their programs out further into something that provides more access at a sustainable cost into the application. So I would say that those opportunities are written into each one of the initiatives, and we did work very closely as we developed the application and through our request for information process in incorporating those ideas. Ultimately, the intent, kind of our vision, when the Rural Health Transformation Program is complete 6 years from now, is that Alaskans all over the state, but especially those living in rural communities, have access to an expanded suite of services than they do now. They have that access closer to home, and that is provided in an affordable and sustainable way.
Okay, now let's go to Katie Stavick with the Frontiersman. Katie?
Hi, thanks. My question sort of piggybacks off of that. In the proposed initiatives, number 5 focuses on strengthening the workforce. And I was just going to ask, what, if any, incentives have been discussed for retaining healthcare workers, especially in the rural areas of Alaska?
This is Commissioner Hedberg. Thanks again for that question. So today we have a current healthcare workforce program that works with communities for incentives to move out to a rural community or an incentive to pay off a student loan, as an example. These funds through the Rural Health Transformation can accelerate those retention strategies that we know that work. It's also intended to build out new workforce professionals. As an example, community health workers that is just starting in Alaska, that is well known in the lower 48. In addition, we also built in that we want to for adults to upskill or reskill. If they're in the healthcare sector and they want to work, we want to build out pathways so that they can gain the skills that they need, the certifications if they need, or the apprenticeships, so that they can stay in their community and work. The tribal health system has a great community health aid program, dental health aid program, dental health aid, behavioral health and dental health aid. We want to continue to support that delivery mechanism, but to expand it so that every village has access to those types of providers as well.
Okay, and our last question, we come back to the room for Johnson Kuhn with KTUU.
Yeah, I understand this has been touched on a little bit, but just more directly, I'm wondering if someone could speak to what the Republicans' repeal and replace plan is for Obamacare, and does it make an immediate difference for Alaska Alaskans who will lose Obamacare subsidies?
Well, I wouldn't refer to it as a repeal and replace plan. It's a bipartisan plan right now that we're working on. As I mentioned, the Obamacare is not working. It's not working for Americans. It's not working for Alaskans. Premiums are up since 2013 by almost 500%. That's not affordable. We had an individual market with 4 insurance providers crash the system when it came into effect. I remember when I initially came to the Senate, we went down to 1 provider, 1 insurance company. They were getting ready to leave. I called the Secretary of HHS and said, do you have a plan for Alaska when we have no insurance companies in the individual market? So the system has not been working. As I mentioned, the extension of these premiums, the cliff that we're going to see in the next 2 days, those are all party line votes to do that. However, my view is that despite the fact that that was a party line system put in place that's not working, the only people that it worked for, as I mentioned, were the insurance companies. Look at their stock prices since Obamacare came into force. They've done extremely well, and so have their executives. All that being said, when you got guys like Jeff Lamfield talking about a significant premium increase, there's thousands of Alaskans that are going to see that if the premium tax credits expire, despite the fact that the deadline in the cliff was a party line vote. Wouldn't have put that in. It should be noted that Democrats put in a electric vehicle subsidy that went to 2033. They could have done something similar with this, but they chose not to. The idea right now that is getting bipartisan support, again, I've been working on it over the holidays, is a likely 2-year extension, tapering of these premium tax credits with reforms such as some kind of income cap. Right now, these premium tax credits, there's no income cap eligibility requirement. You can be a multi-millionaire and get these premium tax credits. And also some kind of minimum premium, maybe $5, just to make sure that people know that they're in the system. There has been documented efforts. GAO just did a report of significant fraud where groups were being signed up by insurance companies. Remember, the money goes to the insurance companies, not to the people, and they've been benefiting dramatically. So something to address the fraud, something to make sure these premium tax credits don't go to illegal immigrants in California. That was something that was a huge abuse of the system. They're not supposed to. So some kind of reform, and then a broader reform to the system, particularly what are called health savings accounts, where the money, and there's a lot of it, as was already stated, goes to the user, the individual, the federal subsidies, not to the insurance companies. So these are the issues that we're working on right now. It's bipartisan. I think there's a lot of Democrat senators who would also agree that the Affordable Care Act, so-called Obamacare, has not made health care affordable, even though we're spending enormous amounts of money on it, and that there needs to be a reform. Again, a lot of that is going to the broader debate. The good news today is that we finally, Alaska, have significant federal support, historic federal support that we've never had before in the history of our state, to try to make our system have more access for Alaskans, a stronger workforce, upgraded with technology, and this will help all of us. It'll help lower costs, it'll help make us healthier. So we're working on the broader issues that, as you know, have been debated back and forth for over 10 years now, but today's a really important day. Today's a historic day. Today's a day that I think, with innovation and smart people like Commissioner Hetberg and others, Sarah on my team, we can finally start to design a system that doesn't put us in a federal straitjacket on everything that they don't understand about Alaska, to address our unique challenges with the appropriate amount of money. As I mentioned in my opening statement, all the formulas that I viewed as it relates to health care from the federal government, we get the short end of the stick. I don't know why. The fact that we're one of the lowest recipients of Medicaid matches in the country makes no sense. None. Today, we're having a different outcome. Alaska just got the second highest award of any state in the country because of our unique challenges, and that's going to be for 5 years. $1.4 billion to transform this system. That is a very large sum of money, and I hope we get all stakeholders to work in a constructive way to do that. In 5 years from now, hopefully we're talking about having one of the best healthcare systems in the country, and we can do it. And we finally got the money to do it, and that's a really important, exciting day.
Congressman, you want to say anything?
So I don't think there's an appetite for repeal and replace for Obamacare, but I think what there is an appetite for is fundamentally addressing the cost of health care. About 7% of Americans access health care on the Obamacare exchanges. We need to make sure we're doing something for 100% of Americans. And so what we're looking at doing through this rural transformation health program investment and other investments and other reforms in Congress is addressing the entire healthcare picture in our country. You heard Senator Sullivan talk a minute ago about the fact that the president and all of his administration and many of us in Congress are working on MFN, Most Favored Nation. What does that mean? That means that Americans should not be paying more for prescription drugs than members of the European Union, members or residents in Canada, right? This doesn't make any sense because most of those drugs are developed by U.S. pharma companies. And yet the United States healthcare consumer is paying the lion's share for everyone else. They're getting a free ride on our investment, right? So this is a fundamental issue of fairness, and we are introducing fairness again on that component of the healthcare system. When you look at the amount of money that has flowed to health insurance companies, as Senator Sullivan alluded to, the stock prices of these companies have shot up since Obamacare passed, in some cases over 700%. Well, companies' stocks don't rise because they're doing poorly. They rise because they're doing well. And an insurance company is incentivized not to cover you when you have a health insurance problem. They don't want to pay, right? And we see this throughout the system. There are these management divisions within each one of these insurance companies that are designed to deny care. We hear story after story in our office, and I'm sure in the other offices, about people who have valid medical issues. They file claims with their insurance companies, and the insurance companies deny. Why do they deny? Because that's how they make their money, by not covering people. So shoveling more money into a system that's designed to deny people care doesn't result in more health care and better health outcomes. It results in higher stock prices for insurance companies, and that's not healthcare. We have to address the fundamental problems, and that's what we're trying to do.
And I would say just maybe we do another press event on what's happening with drug prices, because what the president and his team are doing, I would call is really revolutionary, and I think it's going to benefit everybody, including Alaskans, tremendously.
So as we wind down and wrap up, I just want to thank all those that were involved in this. It is a historic day because, again, the reason I really support what has occurred here is it's transformative. It's not a subsidy. It's not doing more of the same. It's not doing the same thing over and over again and expecting different results. This is a real opportunity, if it's done right, to actually change the system, to have a system that's going to have better outcomes, that's going to be cheaper, and that's going to use technology. So no matter where you're at, you'll be able to deal with your healthcare issues in a much more effective manner. It's not a money grab, it's not a subsidy, it's an opportunity. The federal government sets a lot of rules when it comes to healthcare, insurance, et cetera. This is an opportunity, and I do think it's appropriate that the federal government invest in transforming the healthcare system across this country, and that's what's happening. I want to thank Dr. Oz for his work on this. I want to thank the Department of Health and Secretary Kennedy. I want to thank President Trump because he's talking about drug costs. He's talking about insurance. He's talking about better outcomes. Elections do matter, You have a new administration in Washington. This is year one, almost year one. I know sometimes for some it feels like year 3, 4, or 5, but it's year one. There's a lot of stuff happening. This is another example when you have great relationships with the federal government. You have great delegation, Senator Sullivan, Senator Murkowski, as well as Congressman Begich working on these things in conjunction with the state of Alaska. And so it's an opportunity. The question is, will we take advantage of it? It's our goal in my administration to do everything we can to make sure that we set this on a proper footing right out of the gate, so that 5 years from now we can look back and say, absolutely, the system we had back then totally transformed. The system that we have today 5 years from now is a system that we all could imagine and that we could bring into place. And so look forward to continuing working with our federal delegation, this administration in Washington, and doing great things for Alaskans. So with that, I want to wish you all a Happy New Year and be safe. Thank you.
I don't even qualify for the subsidy, but I don't make that much money. I mean, I make good money, but it's like I make like $100,000, $120,000 last year. So yeah, but you're 20 grand. I got to spend.